Okay, so we're gonna start on some cranial vault techniques now. I always like to start with the frontal bone. So my dear, yes, you're such a good girl. So this hand placement, I typically like to put up here to give her some reassurance that everything's going to be fine. And with my hand that's actually going to be doing something, I'm just going to place it in between her eyes, slightly above the level of her eye, looking for the suture. Good girl, I know. She says I've never had this done before. Okay, and my sleeve is in her way. Good girl, Mama Bear. Okay, so just above the level of her eye, hand right across the forehead. Good girl. And wait for some engagement. So this one in particular, we're going to wait for tissue engagement. We're going to give her the opportunity to respond. There are two components to this one. So there's tissue compliance and there's viscous compliance. So once we achieve tissue compliance, we are going to attempt for viscous compliance, and we know that we've achieved that by the use of our sticky hands, or as Dr. Sandy likes to call it, our tree frog fingers. And we are going to gently, once we kind of got ourselves connected with the bone, then we would gently elevate our hand, 5 grams of pressure, to attempt for viscous compliance. And obviously we haven't gone through tissue compliance with her as of yet, but it's the same hand placement for both of those techniques, both of those pieces of the puzzle. We don't need to move our hand, we just need to back away from her forehead with 5 grams of pressure with our sticky fingers. And the coined term is the boingy boingy whoosh. So the boingy boingy, when we're pulling away, means that we've got the tissue compliance. The whoosh and pull off energetically with the hand is how we know we've got viscous compliance. So the frontal bone technique, the purpose of that is to address and release the sutures in the frontal bone, and to access the intracranial membranous system from a rostrocaudal standpoint for the vertical portion.